Prosthetic is a custom-designed, fabricated, fitted, and/or modified device to treat partial or complete absence of external body segment for the purposes of restoring physiological function and/or cosmesis. This is administered by a prosthetist, who is specifically educated and trained to manage comprehensive patient care. Things to consider before opting for a prosthetic leg include: how much range of motion does the residual limb have? How much pain you're in? What's the condition of the limb or the condition of the skin on the limb? And another important part is the type of amputation, above or below the knee. If you have a transtibial prosthesis, like the one here, it's typically easier because you only have one joint of motion. If it is a transfemoral prosthetic, like the one here, then you'll have two ranges of motion, and if the knee joint is intact, the prosthetic leg takes much less effort to move and allows for more mobility.
Before your procedure, a rehabilitation team will be created. This team may include physicians, therapists, surgeons, nurses, and any others involved in patient care. But most importantly, you are the most important person on the team. Post-procedure, you will learn how to walk with your prosthesis by weight shifting and breaking down gait pattern. You will also do daily activities such as bathing, dressing, cooking, cleaning, shopping, and many others. You will also learn how to take care of your residual limb to help with swelling and pain and any other issues. You will also improve your strength, posture, and balance.
So today we're discussing what it looks like to get ready for a prosthetics device. You're going to meet with your team and they're going to talk about what it looks like for your ADL. So this could be running, walking, showering, and really anything else that you do on a daily basis. They're going to talk to you about what it looks like to use a knee sock, and they're also going to talk to you about temporary and permanent prosthetics. So your temporary one is the one that you're going to get after you get out of surgery. This one is the one that is not fitted to yourself, but instead you're going to learn to walk and do just the normal things with this first. And then you're going to talk to your insurance provider and your primary care and your PT about getting a permanent one. This one is the one that you're going to use on a daily basis, and it's super important that you do learn how to use your prosthetics fairly quickly because this is what you're going to be using on a daily basis.
Just a few tips on the skincare with a prosthesis. You always want to wash it with mild soap and water and pat it dry with a towel. And afterwards, you want to include your bandage around your limb to prevent infection. If you have dry or crackly skin, always use a softening cream or lotion. And it is always important not to use talcum powder. If you need powder, use cornstarch. Do not ever try to shave your limb for the risk of ingrown hairs, and always remember to use sunscreen when your limb is exposed to the sun.
Limb care is important for comfort, movement, and fitting of your prosthesis. Swelling is a factor of this. Limb shaping can help with this by using certain socks known as a shrinker sock, as shown in this picture. You also need to take a shower at night versus in the morning because the hot water can increase your swelling as well. You also need to focus on positioning and strengthening of your limb. Ways you can do this is by never sleeping with a pillow between your legs at night, and you can also do exercises such as laying on your belly for at least 30 minutes a day, a couple times a day.